Hello, everyone, and welcome to a new BetaCast, episode number 4. Um, Let me start by thank you to all our guests for joining us today. First, let me introduce you, Stine. She is the co-founder and COO of Radiobotics. Do you want to introduce yourself further, Stine?
Yes, of course, and thank you for having me. So my name is Stine, and as Jose just said, I'm the co-founder of a company called Radiobotics, and at Radiobotics we build machine learning algorithms that can detect diseases in plain 2D X-rays, and we are sort of working on implementing these at the hospitals. We've been working for 2.5 years now. We have installed them in some hospitals in Denmark, and we are planning to do some clinical trials and studies around the EU. As of now. And yeah, I can tell you more about what we do and things later on.
Awesome, really nice. Thank you for being here. Now, let me introduce you Cristian. It's from Mediktor. He's a co-founder and CEO. Cristian.
Thank you, Jose. And thank you also for inviting us. We at Mediktor, we use artificial intelligence to guide patients having symptoms to the right level of care. We have built up the most accurate medical assistant for triage, pre-diagnosis, and decision-making support. So basically, it's a tool where you just tell how you feel, and we try to guide with some questions and providing an outcome to the right level of care, if you have to run or not, and we provide also a list of possible conditions you could be suffering.
Thank you. Thank you. So now let me introduce Eduardo from Uphill. He's the CEO of the company. Eduardo.
Hi, everyone. Thank you, José and Betty, for having invited us. My name is Eduardo Rodrigues. I'm co-founder and CEO of Uphill, where we do clinical training and compliance analysis for hospitals with several projects in Europe and in Portugal.
Thank you. So let's start on the first question. Are you guys ready? I hope so. So let's start speaking a little bit about artificial intelligence and all of the things that are going on. As you know, technology and startups, especially on this field, are more and more present. But now the question that I want to ask you is, will this be prevented? If there was like some method, and we have heard of that Canadian company that had an artificial intelligence method that was studying diseases that could spread. Actually, they had warnings on the beginning of January, the end of December. How do you think that this could work out between, like technologies that startups are developing and this pandemic? Could it be somewhat avoided, or at least being taken care of in a different way? So, Stan, do you want to give your perspective in here?
Yeah, so I mean, there are many things to add when you talk about AI and automation of a lot of things within healthcare. And there's also many levels. So one thing is to look at risk levels, right? Like where would you apply such a thing as AI to, something that's highly complex and highly risky, as to those that are more routine based. So I mean, first of all, there's a lot of categories to look at. Where would you go for this, and where would you see solutions that would actually work? Because you also have to think of the time is still a thing. There is a reason why it has taken us at Radiobotics 2.5 years to build a very simple algorithm that can detect OA in a knee X-ray. I mean, that is, it is difficult, and we're dealing with things here where we still are facing a lot of challenges when it comes to the intelligence of the technology in some way. So I also really feel we have to consider that time is one thing, and another thing is the testing of these things. It takes long to establish a connection to a hospital to do these testings. And in the time of the crisis, obviously, a lot of institutions are much more willing to fast track these things. You see it within the FDA in the US, you see it with the MDD and the MDR regulations here in Europe as well. We are willing to do those things. But again, for it to work, very probably, we still need time. And also, what I've seen, at least working with a lot of doctors, is you're very forgiving towards humans, but you're not very forgiving towards technology, and that will not necessarily change very fast. So we need to build something that you can trust. And I really think that there are maybe other things we should look into rather than the COVID in some way that we could solve, so we could have, free the time for all of the doctors so they could take care of the patients, because it will still take some time for us.
Yeah, but on your perspective, we'll still need a lot of data, just to make this work. And more people want to have their data private. And how can we solve this problem? Because is it going to be different rules?
I mean, the Kaggle data set that is just available now, we can't all be training the models on that little thing, right? So, I mean, it is difficult. I spent 10 months here in Denmark to get access to patient data, to get the permission to get access to patient data. And I mean, that is, maybe some will fast track that, but just collecting the data, and then I have access to the data. I need to hire 5 radiologists, which are very expensive, to annotate the data. So one thing is the access. I can't even train on it when I get it, because it's obviously not fit for training. And then we have to annotate it, then I have to test it, then I have to validate it. Or you know the drill of building these algorithms, right? So and that's what I'm saying with the time, that before we have made something that actually works, and we have a big enough data set that is actually diverse across all countries, and just in Europe, for instance. And so, I mean, it takes some time, but we should also invest in those. And another perspective you can put on this would be, because we're all working so much together and we join forces, and the EU is really trying to see how we can work together as this, maybe we can fast track it, and we can have the public help with this, because the wisdom of the crowds, which is a very old term that we used when you work with technology, is a thing. And we can maybe benefit from those, but we still have to be much more open, and we still have to give access to the data before we can go somewhere.
Cristian, you are on this field, actually, artificial intelligence, and you work with this data. Like you told, you ask patients a series of questions, and you interpret that data, I guess, to have different conclusions, and you work with that data. How do you see this going on the world, using this data to predict, to trace, especially on the treatment side? Can we solve these questions faster with artificial intelligence?
Well, I think, first of all, it's having the information upfront. And I think that with this disease, we are losing the game. We are not playing against the disease with the data that it's needed, or even that people it's willing to give you. I mean, we assess symptoms online. If we could assess the full population of a country, we would have a clear picture of where this disease is spreading, more or less. And also, we could take more tailored actions, not just a lockdown of a full country. So I think, in general, I see that we are not using the potential of eHealth to go against this virus, and we are not using even the most basic information to take more, let's say, not so big actions against the virus. And of course, AI can help, but we are even on a step before. We are not using even the most obvious information to take some action. And on top of that, when you have the structured information, of course, you can add layers of artificial intelligence to even go further.
Eduardo, can you give me your intake in here, and just let me add a question to you. You were present. You were one member of the Health Parliament in Portugal between 2017 until 2018, according to your LinkedIn. So let me ask you something. Was the pandemic on the topics that you were speaking at the time on the Health Parliament in Portugal?
It was not, actually, it was not on the topics. It should have been, actually, but as you know, pandemics are kind of recurrent along centuries, and we have the luck or unluck to have a pandemic today. And regarding the previous question, and I'm not an AI fanboy by default, I think that we have an opportunity, of course, but we also need to assess the usefulness of having AI with coronavirus, because coronavirus, as any viral disease, the course of the disease is predictable in terms that we know. And for that, we need to ask ourselves, why do we need AI specifically for coronavirus? Why should startups right now, they should really focus on coronavirus? As we know, coronavirus is going to be on the headlines today and for the next weeks and months, but it's not going to define humanity. So if we need to address our focus, where in the coronavirus disease should we focus on? Is it tests? Do we really need tests? Can we predict the result of tests without the person actually having the test? Is it deterioration of the patient? Is it hospitalization? Can we predict hospitalization based on the evolution of the disease? Is it death? Can we prevent death? Can we mobilize resources in order to prevent death in some patients? Or is it, as Cristian mentioned, stratified quarantine? Can we really balance the weights in economics and healthcare so that we can go on to our normal lives with the help of technology without harming economy as it is being harmed by the last weeks? So I really think that utility is key right now. And of course, we need to assess the risks, because right now when we see a lot of movement, a lot of startups trying to focus on coronavirus and actually having access to more data than just the data needed to collect information about coronavirus. And this is actually something that worries me a lot. And as Sørensen also mentioned, we need to assess, and we have fast tracks for that, but we need to assess really the security of these algorithms. Can we really have the same level of efficiency and effectiveness as we have in other drugs and in other medical devices?
And there are, and let me just say, there will be always secondary interests on some people, some fields when they collect this data. But let me just add a follow-up question to Cristian and to you, Eduardo. Just speak a little bit because of your opinion here. So you think in China that have all of that, that like they are data driven. They know where people went because they have a tracing factor, a really strong tracing factor. So the advantages of having this are clear. They now can trace a lot faster the people that were in contact with the patient of COVID. So do you think that on the balance, when you put things into perspective, how do you think that we should behave when a pandemic comes? Do you think that we should have some kind of trigger where we can implement this fast to combat and then take it off? Or do you think there is no way that we should go make sure where, or at least overview where people are, who have been with, and so on? So just give me your perspective here.
Well, that's a tricky question, but I think, and Eduardo opened it also the conversation in that sense. We are talking about healthcare on one side, so we have to make things serious. In fact, we are the only clinically validated medical assistant in the world today that has conducted 4 clinical trials to prove accuracy, and that's a must. I mean, if not, we'd have a nice toy, but not a clinical or medical device. And in second, it's all about privacy information and the data and what you do with it. And that's also one of the most difficult things to solve in a good way. First of all, I believe that data related to healthcare, we have never forget that the owner is the patient. So we should allow the patient to share the data when they want and not when they don't. But don't lose our mind with messing up with this. I mean,
even on these times, even now, where patients could be like contaminating other people and passing the disease. Even now, do they have like I'm just being like the devil's lawyer here and like trying to give a different perspective. On China, they just trace it and they don't give an option now. Like
that's an ethical problem, not a technical problem. So I don't have an opinion on that, because that's a problem that politicians should do what they think they should. On my own opinion, we shouldn't step on that way. I don't think it's a good path to follow. We have many options before that. Many. I mean, people is willing to share how they feel, and they are doing it in a massive way in many countries, and we are seeing that. You don't have to apply anyone to give the information. People is willing to do it, so we don't have to force it, I think. I don't know, Eduardo, your opinion on that.
For me, we are seeing a lot of initiatives regarding digital contact tracing. And for example, in Taiwan, they did it, I think, and they only allow it to be done in specific emergencies, such as what we have right now. In Singapore, they did it as well. So they have this data, these devices, applications that use low energy Bluetooth in order to connect with each other, and they're using it to trace contact. So contact tracing has been for public health the normal practice. So contact tracing is a thing that happens with any transmissible disease. So and contact tracing happens when you report your own contacts. So once again, this is a case for usefulness. If we're able to identify our own proximity contacts, we can, of course, allow by self-reporting health authorities to map who our contacts are when we turn positive for coronavirus. And maybe that's enough. Maybe that's just what we need. And allow me to say this, because in several countries, you don't have a systematic way of doing this with self-reporting, or at least you don't have a unified way of doing this. You have several fragmented approach, as we have in Portugal, but those fragmented approach are not reporting to the health authorities right now. So that's of course also a danger. And once we can establish, okay, this is not enough for us to regain the power of our economy, then we should move into contact tracing. And contact tracing, and we have standards like the Pan-European Preserving Proximity Tracing that allows, of course, within what's possible technologically, privacy preserving anonymity for digital contact tracing. And that may be helpful, but today there is not sufficiently strong evidence to say that digital contact tracing changes how the disease transmission changes throughout the time. So we don't have enough evidence today in order for us to do an all-in approach in digital contact tracing.
And can I just add something there? Because that is exactly what is the main argument and why we should not do it, is because, first of all, you don't have the clinical evidence that it will actually make a difference, and that should be one of the main arguments from coming from the general public. I mean, we also here to both, like, we are the ones trying to build new technology that takes new measures into effect, and we're trying to change things, we're trying to do things, but we also need to be very responsible in those things, and we know how the technology works, and we're facing a lot of people that have no idea how it works. So we should also be the ones, trying to actually say what are we up against. And as you said, Cristian, there are many things we can do before the tracing comes into effect. And as a fairly civilized European Union, we should try to do those things before, and we have a lot to win. Also, there is a lot of how you say experiments being done in terms of that we don't know, and we can also experiment a lot before we go into this. And I mean, there are still very good ways of communicating to the general public that I think works. So I think the responsibility of the politicians is to speak to my behavior and convince me to do these things and keep the distance, wash my hands, do all of these things before they do any other things. I mean, so I really think this is, for me, the last resort, and I don't hope we go to an area where we would actually see this, because what I'm worried about is will this be an excuse to test out these kind of things? Is this now where we can say, well, we know it works, we've seen it in Taiwan? Because that's also what you hear some voices saying. In Taiwan they do it, in China they do it, and as you said, say it works, right? Is that then we should do it? And then it's also being like, well, we're not sure it works, so then we shouldn't do it. And for me, I will be against that we should do many other things before, and also don't think it's not worth whatever we're up against to actually do those things.
Yeah, and allow me just to add a thing on this, is that what we do at Uphill, we really try to pass clinical algorithms to physicians that are based on evidence. What is evidence? So evidence is a pyramid. You need to have a lot of evidence so that you can say that a particular intervention is useful and effective for a disease. And we don't have that kind of evidence right now. And of course, we need a fast track. It's not a normal situation, but we should not be that least rigorous about evidence when we're talking about digital contact tracing, as it poses a threat to democracy, as we know.
And in the end of the day, the law, going to the same subject, but on a different perspective, let's talk a little bit about regulations. Stine, you were speaking about like how fast can FDA go now into the approval of a new vaccine? Like they are all talking there. We are talking about European approvals here. there are different kinds of devices, different kinds of levels on it. Do you think that with the right regulations we could solve this problem faster, or do you think that we have and to all of you, do you think that we have too much regulations that will create a barrier in terms of collaboration between us all?
Well, I mean, there are different perspectives. In normal times, you would, of course, as being a startup that is trying to build medical devices as a software, whatever you do, you would like to comply to whatever rules they are, because you would like to build something that brings value and that is tested, as you also said, Eduardo, that there are things we would like to do those. We would live up to the highest standards. We have everything to win to do so. But in terms of crisis and in terms of where things are unpredictable, we obviously also need to act differently. And I hope and I think there will be, things put into place that can actually fast track some of those things. But it still goes back to my point about time, because there is a reason why it takes very long time to test things. There is a reason why that I've also worked in a big pharmaceutical company, and there it takes 5 to 10 years to even have a pill or a compound approved, and there is a reason for that, and we should also trust that there is a reason for that. And I mean, in terms of vaccines, obviously we have a lot of knowledge that we can leverage on, that we can build on top of, but still it is a very, very different thing. And it turns out that it mutates. It turns out that it's different in different continents and things. So, I mean, in order for us to have something that we can trust, it will take time. So I really also think that the governments and authorities, they cannot necessarily fast track just because of fast. It will take some time to test it. But one thing that is happening, and maybe it's happening tomorrow, we don't know, but of all of you working within the EU, that the MDR was supposed to go into effect in end of May, and maybe tomorrow it looks like that the European Union or the European Commission will actually postpone that for a year, so that we still only have to comply to the MDD, which is a much less strict, directive. So it's from the directive to a regulative, and that will maybe be public tomorrow. We're not sure yet, but if that happens, we actually gives a year to have a little bit less regulation, and that's a fast track in itself, I would say.
Thank you. Cristian, do you want to give us your perspective?
Yeah, I think that, as I said before, again, we have a lot of things to do before we do new things. We have a lot of solutions that are already regulated and they are not in place. I think that healthcare has been a physical business even today, and it is a physical business. And there's a lot to do with virtual care and telemedicine and devices and all these. Now it's obvious that we need it more than ever, because people is not going to the hospitals because they are afraid to be contagious about COVID-19. So you need to do the remote care, which in many countries is not available in a regulated way. And even in Spain, it's not clear, the regulation. You are not able as a physician to prescribe anything to anyone that you have not seen before. And that, it's obvious today, that makes no sense. And we have a lot to do. I think an easy way to advance is with telemedicine. And it will be a huge impact in healthcare, because it has been the technology there for 20 years, but we haven't really made it. And I think that the big shift that we should do is to allow a broad spectrum of telemedicine, always taking into consideration what should be done and what not, and setting the borders for that. But of course, I would change right away the regulation regarding telemedicine in many countries.
Thank you. Eduardo, your intake here.
Yeah, and I think this is such an interesting topic because, and of course, fast tracking has been there for decades now. So when you have, like, for example, a rare disease, you have several mechanisms for drugs to be developed faster and to be implemented in the market faster. So we should not be afraid of that, of course, with the rigorous process that these agencies are able to conduct. But I think what is most interesting is what Cristian just said about the other side of the regulation, not fitting drug development or a medical device development to the current regulation, but also developing new regulation to assess what's being done right away. For example, in Portugal, as you know, we have several initiatives, patient-directed initiatives that collect symptoms and they provide advice, and they're not medical devices. And how can that be done with the dangers that are surrounding it? And we think that this new area needs to be regulated as we go and as we face it. And this is a huge opportunity for us to see live what are the implications. And for example, symptoms checkers are just a part of it. For example, as you said, telemedicine has been there forever. And in some countries, they still can do it and can prescribe. Of course, in Portugal, we're lucky that we can prescribe a drug anywhere with our cell phone. But there are some countries in Europe that cannot. And of course, I see this much more interestingly in the side of we can develop new regulation right now that eases this process and makes this process available, particularly not on the development of solutions, but on the processes that are being implemented for patients.
And before we go to the questions, because there are already some questions here and some opinions, let me ask you this question that bothers me a little bit. Maybe you can enlighten me. This is kind of my personal. Now, we're talking about different countries. We're talking about Europe, about the USA, not about China. Now, who actually is on the front line? Tell me the country that it's leading this battle and making the best decisions. On your opinions, like, you see where I'm going with this. We have Donald Trump on one side, we have Bolsonaro on the other side, we have President Xi on the other side, we have the European Union fighting this in our different way, and we have the World Health Organization that had a really good reputation before this, and now it's changing a little bit and raising some questions. So all of this is happening, and we have no clear lead. So who do we follow? Where do we go from here? What's going to be on the next day on this sector? Because this is really important, because transparency is everything, and it seems that we don't have a lot of this. It's like a tricky question, but I don't know if.
It's a very interesting question. I think we have, like, we can cherry pick in several countries what's being done correctly and providing good evidence of efficacy. For example, as I said, Taiwan had a very strict regulation when concerning traveling. So they were really focused on the inbound and outbound of travelers and how they could monitor the probability of them having the disease based on the data they collected, both administrative data and healthcare data. So, and that was really interesting how they focused on the borders first thing. And of course, due to the proximity with China, this was highly relevant. And then you look, for example, at South Korea, and South Korea had two things critical. They had a very intense contact tracing, not a digital contact tracing, but a manual contact tracing with phone calls and digital reporting. And they, and provided that they had enough tests to apply to those who were traced as contacts, they were able to really quarantine fast the exposed. And for example, you then see the US, and one of the biggest problems of some societies is the lack of cohesion of the healthcare system. And you see the patients, they were traveling everywhere, and you need to follow them, and there are needs to have high communication and correct communication within these geographies, and the United States does not have that in place, as for example we have in Portugal, where we can map, of course a much more smaller geography, but where we can map the clinical records to a centralized system. And then Singapore, for example, where you had the digital contact tracing, that was really an innovation, a turning point in the technology right there, with an efficacy that we don't still know what it is. So I don't think we can pick a country and follow that country directly, but we can really cherry pick some things that are being done everywhere.
And so, using your words, let me just ask to Stine now, how did they do on South Korea? The tests in 24 hours, they had the result. And on the US, we have patients waiting for 3 days for the answer. How is the difference so high? And looking at this, we have even a question here that the US just said that will stop contribute to the World Health Organization. How do you see this? The impact here will be huge because we know that they are one of the main contributors here. And look at Dr. Fauci. We have Dr. Fauci on the right side of Donald Trump having his opinion, but the politician on the politician ecosystem. And now we have the main virology in front of the cameras speaking to an entire country. Do you think that they could have a different authority here? So your opinion in all of this. Tell me, I want to hear it.
Well, it's very, very difficult, and it's hard to judge also because we have to remember we are still in the middle of it. So we also still have to see, where will we go, and what would be the price of these things, because I also can see that there are some that are very protective in terms of keeping the economy running and calculating what is the price of a normal influenza, how would you, or a flu, or how would you see like the normal death tolls in whatever is happening, and that is also something we have to consider it. But it's also very, very political, and I don't necessarily want to judge because we're not over it. But I can say I was in the US the week before the lockdown happened in Europe, and there they didn't even pay attention to it. It was not a thing, and there they managed really well, saying this is something that comes from Europe. And being a European then in the US the week before was like, yeah, sorry, I'm from Europe, but I think I'm fine. And there you would have to pay $1,000 to get a test, and there you wouldn't even know if your insurance would cover you if you were actually ill. So nobody wanted to get tested, and nobody wanted to go to the hospital. And that also happened a week before they even acknowledged that it was a thing, right? So I mean, they have just been behind in many ways, and I feel it's if you look over there, you can see that it is very, very different from what we're used to in Europe. And if they have done some right measures, I really don't know, but I can at least see what I read in the media and things, that to me, it is not necessarily where we would look towards being inspired. I think it will be looking towards what they're doing in some countries in Asia, like Singapore and South Korea and Taiwan as well. I really think that is where I would turn towards rather than the US. In terms of just elaborating a little bit on the WHO that Trump, he then refused to pay, that is for me 100% a political maneuver he's doing in terms of finding somebody he can blame. And that is nothing more than that. And it is a pity, not necessarily saying that you should trust any authority blindlessly and that you should support it no matter what. But I still think that in this case, there is, it is a blame game rather than collaborating. And for I would hope that whatever European countries, they would at least try to collaborate rather than blaming someone. And that is at least what I hope. So, and also just to elaborate a little bit more on what are the countries doing, I really, really think that we have to we still have to wait and judge. But for me, I'm actually okay. Like personally, I'm okay with so I sit in Denmark, and for me, it's like I want the government to take action, and if they take action, and if maybe they take the wrong or they do a mistake or something like that, that would also be okay. I can live with that. At least we did something. And that is for me something that is very, very important, is the action. And that is also where you can see things are going quite well. It is they take action, and they can be very quickly put, support into places of supporting companies, of restricting social activity, all of those things. And for me, the crucial thing here is acting. And that is really what I would like to emphasize on, in the sense of, if you manage to act, I think you can come a long way.
And Stine, you were talking about the economic side of this, and Cristian, before our talk begin, you were speaking about the economic side and the impact that this could have on our economy. And we all already are seeing this. We have more than 10 million on the last 2 days employees in the US. And we all know what happens when the US economy explodes. So give me your opinion here. Where do you stand in all of this?
Well, I'm not an expert on the impact, but I like to read a lot. And of course, we have a problem. I mean, a total shutdown of the world is a high cost that we will need to pay somehow. And of course, we foresee a economical disaster. I mean, that's obvious, and with no situation like this before. So I don't know. It's a huge thing. It's coming, and what I would like also to add in the previous question when you ask about what has been done so far, and I also think that uh, we as humankind we have failed so far. I mean, we haven't acted as a group. Everyone is doing what they think they have by their own, taking a lot of bad decisions, decisions made by people that were not prepared to take that decision because nobody foreseen a pandemic. And I understand that, but I cannot understand that they could leverage on the knowledge of the industry, and they have not done it. In many places they done really not the good decision because they did not ask the right people to do it. But for me, we lost the battle of the information against the COVID, and we have not act as a global world. We have act like local citizens, and I don't think that that's the right move against a global pandemic.
Because in the end of the day, like Christine was saying, it's all about collaboration. We need to collaborate with each other and make sure that startups from Portugal, from China, from the US, we all come together and we find solutions. But these collaborations are being harder and harder by the time, and I'm mentoring a lot of startups and I'm seeing it happening. We close in our ecosystem, and we all close in the ecosystems of our own countries. Now, how do you see, Eduardo, on Portugal? We have the tech for COVID. Do like do you know if they communicate with other groups on different countries, if we collaborate with each other, if we share information, or if we are trying to do it by ourselves, and how the other countries are behaving?
Yeah, just about the thing about collaboration is, as Christian mentioned, diseases they see no borders, right? So if you go to a border, there's nothing there except between Mexico and the US. You won't see anything there. So the disease they pass, they flow as they can through humans um, to traffic, whatever. So collaboration must be there in order for us to fight a pandemic. And this is almost like a joke, right? Because you saw this that things these they said about the flowing of the pandemic throughout the world. So first there was China, and then Vietnam and Thailand. They were like, okay, this is just in China. China was cutting streets and closing borders, but everyone was peaceful. And then it moved to Europe with Italy, and everyone in Europe was, this is just in Italy, so we won't worry about this. And then the US was like, oh, this is just Europe. So you saw this throughout the world. This is not something that was minor. It was major in fighting this pandemic. In collaboration, of course, is critical for us to fight COVID. In Portugal, I don't know if the other guests know, but we have like a movement, a tech movement of volunteers. That they like a vigilantes for COVID, and they organize themselves developing new solutions for technology solutions for COVID, and I think they've done a fairly good job. I'm still worried about the articulation with health authorities. I think that is prior to collaboration. Okay, it's really important for us to give what we know to the community and to develop solutions that can help our country and Europe. But we must know that solutions will affect everyone's health, and they must be highly close to what the health authorities are doing, what the healthcare system is doing, and they must not foster a fragmented environment in tackling COVID. And I'm deeply worried about that. And I think this is one of the major topics in these movements that we're seeing. Of course, there are other situations like some companies taking advantage of the exposures they have with this to sell or to collect data or to plan ahead of COVID, and that is also something that worries me. I don't know. I don't know the movement from the inside out. We're not directly involved with Tech for COVID, but I do know they have some contacts with people that are associated with other countries. Right now, I think it's a more closed environment in Portugal, and they have several initiatives. I don't know what the real impact has been, but it sure is an interesting initiative that has circulated a lot of news in Portugal.
So let's bring some questions that we have here. First, let me still in video. Hello, how are you? Susana Salgado said, obviously, this new reality regarding COVID-19 as an opportunity for Healthtech protagonists. But what are the major risks to identify? Do you agree it's an opportunity, or do you see it as a? Do you want to give your opinion? Your your opinion sounds European. Sorry, I'm saying this for a long time. Your
Can you just
opinion.
repeat the last part? If it's an opportunity or a threat to what?
I think to society in general.
Well, I like to obviously there are a lot of threats because it's obviously deadly. So I mean, that is the obvious threat, and we need to, and it's challenging the way we organize ourselves in society and everything. And but if we leave that away, I also think it creates a lot of opportunities, and there's opportunities in many aspects. Just one thing is that all of a sudden, people are starting to appreciate touching things and touching each other. I mean, that is for me crazy to think of, that the only thing that all of these people that has been locked down for so long wants to go touch things, because that is obviously something that you should refrain from, but also have physical contact, and those kind of small things is for me also a wake-up call, but also opportunities for us to rethink things we're doing. So there is some on a human side, there are opportunities in terms of, so I worked personally with digital transformation the last 10 years, both in the pharmaceutical industry, building my own startups and building technology. And I would say that what has happened in terms of digital transformation within the last 4 weeks is what I have seen the last 4 years. So for me, that is also a massive opportunity that we have seen something. If it will last, that still remains to be answered. I'm not sure, because I don't trust that things will go back to some kind of normal at some point. But we see some things. So both on a human side, on a technical side, I've seen things. I also think that, for instance, I read an article about that in the US, that you today attribute so much honor and so much respect to the veterans, to the military, those fighting in the front and protecting the country. A bullet cannot kill a virus. So you will also see changes in, would you then start to appreciate much more those working in the hospitals, the nurses, the clinicians, all of these that is trying to help us, take care of us, and even die for this. And I mean, so hopefully we will also see a shift towards other areas of society that brings a lot of value that we have forgot to appreciate so much. So I see a lot of things.
I saw a statistic recently that showed the amount of doctors that were dead on the COVID, and the number, like on the ratio of doctor per country, the number was staggering. It made me afraid, and we're talking about doctors, nurses, and so on. The number was talking about that, and it's really fascinating how we shift and we go to our windows and we start clapping to them, because actually I completely agree with you here. They should be treated much better in the society in general. And so, Christian, in your country, like we've seen on the news, Spain was tackled, like the COVID went good there. How do you see people react there in terms of new technologies to solve this? So how is the Spanish people collaborating with each other? Because in Portugal we have the Tech for COVID. What's happening there? Tell us.
Well, I think always the community reacts hard, and as in, I think in everywhere, we have a local community also trying to bring up solutions to tackle the problem. But I also see on the other side, politicians afraid of technology and innovation, because now are hard times to make decisions and they don't want to take the wrong one. So well, in fact, we have offered our technology for free to the Spanish government, and we are still talking to the Spanish Ministry of Health for giving it for free. And we are still in conversations, and I think that are tough times also on the other side. So to take the innovation path, it's sometimes risky, and I see a lot of things happening, and a lot of things will happen faster, but also some decisions are hard to take. So we have a double angle on this situation.
Eduardo, I'm going to read a question from Falden. How can the ecosystem be built so that the health tech can be integrated and complement the medical, public, and private resources that are scarce throughout time, and especially during the crisis like this?
Well, so just following up on Stine, and regarding that question, I think there are several risks in our involvement as startups right now. So the first one is to have an unreal solution that is just there working because of the noise that exists around COVID. And I see, for example, other startups shifting to our sector just because it has a high demand now for solutions tackling specific questions. So this can be temporary, of course. And also the digitalization is an opportunity, but can also be just temporary. So we are seeing a fast forward in digitalization in healthcare, and that is also critical for us. Of course, privacy, we've talked about that. The absence of funding may tackle and may affect new projects that are coming out right now. Of course, we still have some kind of lines of funding specific to COVID, but we don't know how is going the market to be in terms of venture capital and risk capital. But regarding that question, I think that we should address, and I'm really strict about that, particularly in countries like ours that have a very structured approach to healthcare with health authorities at different levels. I really need that these movements and the health tech sector should answer to specific questions, and the government should be able to involve these startups by doing, and you're at BetaE are highly used to that. So to ask what the government needs, and startups can really, they can align what they're doing with what the government needs. So like a process of e-procurement that is public and that addresses real needs, because we're seeing that in Portugal, for example, we have the government working day after day, night after night on solutions, and then we see a simple app gathering users and trying to like divert traffic to their own app, and while the app that the government has made that really has impact is being left beside. So I really think that government should be more open and to state what's being developed, of course, but also to address specific needs that the government won't be able to tackle in this short period of time that we're working for COVID. And I think that is where health tech companies can really be helpful. They can address the governments and ask, so this is what we're doing. We think we can help with this. Even before they start developing solutions, even before they release their apps, I think a connection with the government is highly important, and it can happen very, very easily, for example, in Portugal and other countries in the EU.
Can I just add something
of
to that?
course.
Because I think it's very interesting, because I mean, it is always something building health technology. You would actually like, there is a demand from authorities and from the institutions, and sometimes you invent things yourself and then you have to validate that afterwards because you think it's an obvious problem. But I mean, for me, it's also a clear vision that they need competences, because then they start developing things and they have no idea that there are 5 startups already working on these things, and they just are a little bit ignorant to whatever there is because somebody in the hospital is thinking we need this, and then they try to figure it out. So there also need to be much more collaboration, and I hope this opens up to these, because working with hospitals, they don't invite you inside. I have to invite myself every time that I want to go there. They don't say, oh nice, we need you guys here, right? And I think they also need to be more open towards these things, and we can see other industries have been taught that, they have been used to it, so that is much easier. But here we have an industry that is not necessarily very talented or whatever you should say, in actually working with new technology. And so I really think there also needs to be some resources there that can actually understand what is happening and what is it actually we're trying to do. Because I really think that we should not invent what they need. They should ask us, and I can fairly quickly build it. I mean, I can do a prototype in some way with some data and some stitching and hacking and things in 2 weeks. I mean, I can, and then we can test it and see if it has, can we refine it in some way. But they never reach out to us, and then you see those companies that's trying to take advantage of this. And this is actually something I would like to hear your opinion on as well, because we obviously create algorithms that can detect disease in x-rays. You use x-rays, chest x-rays, to look at lungs, where you can actually see something with COVID. So we have been asked, could we pivot from knee x-rays to chest x-rays? And that is actually very difficult. And we're like, no, we will not go into this, because this is not our expertise. We have a focus. We're not trying to leverage on these things. There are some already working with chest x-rays that can maybe easily pivot into this, and we see that they should do it. But then we were discussing from a strategic point, should we try? And my answer is no, we shouldn't, because I think there is also other things that we need to focus on while they take advantage of these things. And I think it's a little difficult as a health tech startup. Is you'd like to help, you'd like to support, but also, again, you're trying to show something that you're working on. And we're only 10 people in my company, so it's not that I can just throw everybody after this, because we still need to show some results.
Yeah, I completely agree with you, and I am seeing a lot of skepticism on the Eduardo side when he speaks about this, and now I'm seeing from you, and it makes sense, and I see a lot of companies, much smaller companies, ideas that were starting before all of this, and now they are all pivoting, like Navarro, like Neurais. There are a lot of health companies in Portugal that I know personally. And all of them are switching to different ideas to try to tackle some problems. And then they will get back to their solution. And they are doing this because they want to be on the market, they still want to be entrepreneurs and so on. And these same companies are the companies that will pivot a lot faster because they don't have a solid product yet. And by seeing all of this, how can we tackle, because these are two different issues. We have the issue of small companies, small entrepreneurs that want to do something. We think that the government should step in and say, no, we will ask the questions and we will structure this, make a structure on the collaboration. Or you think that, like Francisco has a good point, while it's great that everyone is trying to help, it gets progressively harder to track the overall impact of these decentralized initiatives. How should we define and track what success looks like? This is a really nice question and really interesting. Cristian, do you want to go first and give us your opinion here?
Well, I think we need a clear path. We need to know the problem that we need to solve, and then to find out who is the best to solve that problem. And that's not easy to do. You need to have a knowledge on many things to do it. And you know well this problem because you work in this space. But anyway, I think that we should have at least a structured way to do it, or at least a path.
Can it be technology? Like if the government don't want to solve it, can we just develop some technology that will categorize all of the things that are being worked and track them? Like, can it be artificial intelligence? Because you work on the field, also do I. Can it be there? Or like we just hope that the government step in, or it's maybe we should first develop a tool to do this?
It should be, and I think, as I said before, we are failing as a humankind to build up this in a global scale. Because if we could collaborate to build up this thing as an open source worldwide, we would be in another situation. But everybody is working for themselves, even small companies. So, we will not do it this way. And of course, everybody is not just thinking about helping, also in how they can make some business, because we have also to understand that we are here because we pay salaries. So this is something that
Exactly.
we don't have to regret. I mean, if you are solving a problem, you have to also give some compensation somehow. If not, you will not have anyone tackling that anyway. So it's a tricky thing, and I think that again, governments have to play the role, and they have to lead, but they are not prepared for this. So it's a bad situation.
I think
Eduardo, sorry, I was saying, Eduardo,
yeah.
go on. You were eager to speak. I could
Yeah,
I could see
I
it.
was indeed. Because the thing is, of course, we all want to be somehow part of coronavirus. This is a huge health issue, and people are going to ask in the next couple of months, where was uphill, where was Mediktor during the coronavirus? And here the strategy is quite simple. We need to value the actives that we have already done. So because, for example, Stine, she has the algorithm for X-rays. Us, we're developing it, of course, and we launched clinical cases, simulated clinical cases for coronavirus, so that physicians that haven't seen a case can experience what is to deal with the case of coronavirus and comply with the best practices. But we're leveraging the actives that we have, the strong product that we have in order to address a specific situation. I don't see that as bad. The other thing is pivoting completely to address a pandemic, because there's the thing with pandemics, they don't come today and tomorrow, they come once a century. So if we're optimizing overfitting for a pandemic, then you're not going to have a great business. And that is an important topic. Regarding the what you said about these initiatives are being done and how decentralized they are and how difficult it is to track them, I think I'm not a government guy, but I think that the government can have here a way in order to address or to publicize what are the needs that the government feels that it has, and also to build a platform. For example, we're talking about digital contact tracing a few minutes ago. You cannot have an app that does digital contact tracing without a huge adoption. So you cannot have an app with 50 users for digital contact tracing. It's garbage. It's not useful. So the government must be on the platform side, not on the product side. And that is how I see the involvement of the public sector during the coronavirus crisis.
On the platform side, really nice opinion here, and I also agree with you. We should, like, the first thing that we should have done is develop a platform to deal with the products that will come from
Precisely.
this. And
But I just want to add one thing. On our case, coronavirus landed in our house. We don't move a finger or change anything in our strategy, because we were assessing symptoms since 2014. We just added a new disease in our database, which is validated, CE mark, and ready to be deployed in 13 languages. So in our case, it's the opposite. We didn't move anything. We just added another disease of the 800 available on our system.
so,
and
Stine,
I mean, sorry, and that is exactly what you should do then, because it is so obvious that you can easily integrate and implement those things and even roll it out, and you have even the regulatory pathway there. So for us, for instance, we are actually helping. So right now there is obviously a lot of people that's not going to the hospitals to have their x-rays taken because it's just a trivial examination. They have to stay home because it's only focused on those that are infected by the COVID disease. And there is a huge backlog of images that are piling up at all of the x-ray departments and for radiologists that they will need to take care of as soon as this is over and we start to opening up. And my technology can solve that. And I also think that I'm actually helping society just a little bit by actually focusing what we're trying to do, because there is also going to be a time afterwards. And then I would much rather have you, Cristian, to do your thing and fast track what you do, because it fits so well into your business and this is what you're already doing, than trying for me to pivot into something that I can just maybe even take a little bit of advantage of, right?
and let me just add of exactly what you said. I was talking to my father on the phone yesterday, and he told me something that made me think that it was like, we're all trying to solve the present, but we still have a future, and somebody needs to think about the future. And that's echoing inside my brain, and now we are talking about this, and I think it's a good quote to bring to this conversation. So now let's change to a topic still on the sector, but a more deep topic that we need to take really careful when we speak about this. We are seeing more and more people being alone on their houses, working from house and getting depressed. So the mental health issues will grow, and they are growing. Do you think that, well, before the solution, let me ask you, how do you think that this problem will impact us on the future? And how do you think that we are, if we have the right tools to solve this? Because we are all thinking about COVID and so on. There are a lot of depressions. We have, for example, women violence. It's growing faster and faster. We have these small consequences of people being in their houses, and we are not watching this because the securities, the police are outside managing the streets and so on. How do you see all of these health issues that are growing more and more to impact our society in the future? Stine, you want to go? Okay, Eduardo, yeah, go ahead.
I think that, for example, of course, we're going to see a surge in demand of healthcare after the coronavirus. And that surge is going to be even before the isolation problems that can affect mental health, chronic diseases and rare diseases, and diseases that have a high burden for countries and that are being completely displaced from the priorities. And I think, for example, we're developing algorithms, not AI algorithms, real algorithms, clinical algorithms for hospitals to tackle these diseases more efficiently, since they're going to be working after a period of high losses in revenue. And for that, I think that the mental health issues is going to be top priority for countries, because we're seeing even mental health disorders being aggravated and degrading over time because of this isolation that we're seeing. That happens also with healthcare professions, and with everyone who's isolating at home. And that is going to be, of course, a huge opportunity for startups, but also a huge healthcare issue that need to be tackled, and that we don't have a scale to tackle by human-to-human interaction.
Yeah, but how do you see the impact of technology here? So this social isolation that we are talking about, and even before this, there were some strong opinions that some countries, like Portugal, didn't have enough tools to tackle these mental health problems. If you have a mental health, do you go to the urgências, to the I don't know how to say it in English.
Sometimes you will. Yeah. Sometimes your parents going to take you, or your girlfriend's going to take you. So we do have a structure, but it's mostly a physical structure. And the thing is not, we're not going to be in lockdown, or maybe we're going to be in stratified lockdown. But the thing is, the surge is going to be so high that the health services won't have capacity to deal with it. So it's going to be, for us, what we're envisioning at Uphill is what we're going to see is a new surge of healthcare needs, not related to COVID, but related with the other diseases that haven't been tackled during this period of time. And that includes, of course, mental health as one of the key priorities. And of course, technology is going to help us mitigate the mental health issues. Just the video calls that we're doing, and house parties, and the technology that's out there that enables us to communicate in a way or another with our friends and our family and our social support structure, that of course is a huge enabler. Imagine if we're on quarantine during the Spanish flu, and you wouldn't be able to go out home.
Yeah.
You don't have a cell phone, so you're being completely isolated. And that is, of course, a huge health problem by itself, because if you have like an heart attack or a stroke, you won't be able to call 911, or you won't be able to have anyone with you to notice that. So I think we are in a much more comfortable way, and that's why I think we're adjusting really well to this new reality.
Fine. Give us your opinion here, like again. And I also want to know on Denmark, how do you tackle this problem, this mental health problem? Because I was reading some articles, and you already take some measures to deal with this more than other countries. Tell us what's happening.
Well, I mean, there has been a lot of things happening, and I don't have a clinical background to say, clinical evidence based things about the mental health development here. But I mean, so one thing that has been done fairly quickly is to launch support packages for small businesses. A lot of people have been sent home with full salary until June, and so they are not in the risk of losing their jobs. And we really try to create a massive security net so that we will take away at least the fear of losing your job until June. And I'm pretty sure that that is obviously also something that has helped a lot. And the how you say, the viewpoints we have here is also that we feel that we have been taken care of in some way, and that is also, again, we are a fairly small country, and obviously we also have a lot of budget for these things, and it can't be done anywhere, so it's also sort of an isolated experiment in some way. But I would also say that from a personal perspective, in terms of being alone and that you have to be isolated in some way, I also feel that it's also a time to do other things. And I mean, and we should also talk about some of the positive things that we all of a sudden have, time to reflect on and time to do that. And you can even see people have spent so much time with their kids. There are also bad things happening. I'm not neglecting that, but it's also, for some families, it has really also given them a lot, and some are appreciating the time that they have. And I feel we see both sides, like those where it turns into violence and the kids is obviously suffering in that sense, and then you have some of the families that maybe have more resources, but they can still be together in a very good way. So I see different things, and I hope that we will have resources and also capacity to take care of these things, because we do not yet know what it will be the biggest problem. Will it be obesity because people have been eating and drinking so much? Would it be mental health issues because we have been all alone? Would it be other things, like will people get sick from different kinds of things? We don't know yet, but I still think that there is also, the way I see it, a lot of how to say, recognition of that something will happen, and we will try to take care of it. But yet we can't fix it before we know what the real problems are, in my opinion at least.
Cristian, and let me ask you on this question segment, if you want to call it in this way. Could artificial intelligence detect mental health problems by like just having a software running on your apps, of triggering because Google already does this, okay? Like, if there are some, I don't know, I'm not an expert on the area, I just know software and artificial intelligence. I was reading an article about this. They were tracking some keywords that actually they, in some cases, could go into making, having the conclusion that this person maybe have a mental issue. Do you think that this is the way? How do you see a problem solver here?
Well, I think again that I see a clear solution in telemedicine, and it's not broadly, let's say, used. And I think that we will see a raise on telemedicine related to mental health problems, just because it makes a lot of sense. It's much easier to do it from home. And I know from close friends that there are psychologists that they are these days doing a lot of consultations online. And I think it's a perfect fit for this specialty. And regarding artificial intelligence, I think some things can be done. We have included some of the basic disorders in our system, and with basic questions provided with our medical team, we have the ability at least to see that you could be suffering some of these disorders. So at least it's a first advice to then seek for the proper specialist to be properly diagnosed, but we try to tackle this first step. And I've seen also other startups that has a clear focus in mental health and doing some pretty nice things with artificial intelligence, trying to engage with users and follow up with them. But I think that the clear solution is telemedicine and having a accessible and nice communication way with professionals.
Let's go and read some questions, because we have a lot of questions now. So from Katia Pereira, no, before, the opinion from Stealing Video. It's definitely a turning point regarding globalization. The concept isn't over at all. It's right the opposite. It has to be reframed. And we touched this subject, and I think we all could agree with you. Katia Pereira has a question that is on the collaboration topic. It's not easy to collaborate, but we can choose to do it. But are we ready to do it? Are we really open to do it? Can our networks really act, provide some guidance? And this is going through the topic that we spoke earlier. We still, I think, that was in our countries and our communities. Yes, we come from other countries. All of this acts in different ways. But using this question, let me ask you another question. Do you think that is our government that should help on collaboration, or do you think that this should be European, or do you think that it should be global? On what scale is the collaboration topic being talked here? I don't know who wants to go first. Stine, do you want to go first? Yeah, you are.
I can go first. So I can say some on a personal level. Like, I would not have succeeded in developing my startup if I was not very open to collaborating across sectors, across with other startups, with hospitals, with anything. And I mean, I really think that we can only be successful because we collaborated, and it's something we must continue to do because we're very small and we don't have the answers ourselves. And I would like to take that and put that to everybody, because we will not succeed in this if we sort of stick to ourselves and try to develop our own solutions. I really don't believe in that, but I also acknowledge that obviously borders has been closed. We are trying to do some things because the pandemic is sort of acting differently in different countries. But I also see, at least from our government here in Denmark, I see, and they're being very open about how they speak to other leaders in other countries, how they actually try to collaborate still from a distance. So I feel confident that they are at least trying, and they're trying to learn from each other, because what do you do in times of with so many unknowns? You need to listen to what else is happening. So I think I don't see they have a different choice. I mean, this is the only thing for me that can actually make us make the right decisions, is to collaborate and to listen to each other. I can also obviously understand that there are some that are more authoritative and some that wants to close things and do differently, but then we just don't necessarily work with them. I mean, we also need to find those that would like to collaborate. That's how you do business anyway. Like, those that don't want to collaborate with you, you don't reach out to them again. And those that doesn't believe in your vision, you don't include those. So I mean, we also have to find those that would like to work with us and would like to collaborate, and then we can make solutions together. So for me, it's more a question about who would like to join and what can you contribute with, and then we can move from there.
And how do you see the collaboration with China Health? Because if we collaborated more, maybe we should have a clear view of what's going to come. Like Eduardo said, we thought it was only on China, and then we thought it was only on Italy, then we thought it was only on Europe, and now it's global, more than in 180 countries. So do you think that this collaboration maybe would have saved lives?
Well, you can always go back and say yes. Like, also, even when the virus is here, I don't necessarily, I know it's here, but I'm not going to die from it. So I still don't, we still don't take those kind of things too serious in some way, but also think we have learned a lot. And yes, we will probably listen more to what is happening. We will also be much more alert, because I mean, nobody was really prepared for it, and that cannot necessarily happen again, right? Yep. So for sure, we have learned, and we will be more open and listen to much more to those. In terms of how we collaborate with nations like China, I mean, that is already difficult for many reasons, because they are not so open. They don't report as much as we do in a transparent way, and ethics and a lot of things. So I mean, you can't change a whole country just because of this, and we still need to comply to our ethical standards, to whatever regulations that we have in terms of doing it properly and protecting the citizens. But that's also, again, I mean, we should collaborate with those that we where there is a match in some way. I'm not saying we shouldn't collaborate with others, but we should also just filter those kind of collaborations to what it is and what they represent, because it is difficult. And I believe that we are at least trying to learn from China. But then again, you can also read that they don't necessarily disclose everything.
Exactly.
So can you trust it? Because is it then real collaboration? And would you like to learn from something that's only partly disclosed? I mean, that doesn't really work anyway. So for us, it's very much to size the situation and size the collaboration, and saying maybe this is the half truth. Based on that, what can we then deduct from those kind of things? And that again goes back to, we also need to have our own experiences that we can learn from, because it is also different in each continent in some way, right?
So does anyone want to add something to this question, to this topic? So let's go. Francisco had that question that I told you. Lek told Stine, you are right, healthcare staff are mistreated by the public. I think it's due to the general shift in society, which is driven by the consumerism, people demanding a service. Francisco asked another question. Unsure if you brought it up, but Google and Apple are teaming up for contact tracing, so that has the biggest impact potential on the front line. I think this is like collaboration. It's all about collaboration between if startups collaborate with each other, startups and big companies collaborate with each other, it's even better. But if big companies everybody collaborate with each other, we will get much better. The data that we're speaking will have much better data. But on the other hand, we all know what Google does with their data. So let me just bring back this question again. Do you believe that well, we all have to believe that they are doing this for the greater good, of course, but in the end of the day, what does this mean for the society in general? What consequences will this have in the future? Will this have opened a Pandora's box? Christian,
I think you need
Stine,
to invite Edward Snowden for this one.
Yeah, maybe. We are on strange waters here. But I think, yeah. but every time that you speak on that, especially on this sector, because this is really sensitive. That
yeah, I will leave it to you, Eduardo. I've already shared.
Yeah, I was just thinking about that, and of course, to go forward with digital contact tracing, you need to have high adoption, and that needs to be done at a platform level, or for example, at the application level when it's provided by OS providers such as Apple or Google with iOS and Android. Of course, that is important. The thing is, I think we must have context, because in for example, in the US, you don't have the kind of hierarchy of public health officials as you have in many countries in Europe. For example, the CDC, they issued a paper that stated with the Johns Hopkins University, where they said that it would be needed 100,000 new collaborators to contact trace every contract with a confirmed case, and this is routine in public health. And the thing is, they don't have these people right away and trained to do so. So digital contact tracing may be a need that is being addressed particularly importantly in the US. So it doesn't need to be, as I said before, our top priority, because we still have self-reported contact tracing, which is much more privacy protecting than digital contact tracing, of course. But I do think that collaboration is highly important, and I don't think they are doing this, and this is just a thought, of course, but I don't think they're doing this with the evil side of Google thinking about this. Of course not. This is a real need, particularly in the US, where you have a lack of public health officials. But as I said, collaborations is very good, and for these big companies, huge companies, to go and lead by example in collaboration, this is just fascinating, and this is something, of course, we should follow. This collaboration is key, and of course, collaboration is only possible if we start by collaborating. Otherwise, no one will collaborate.
Christian, do you want to add something?
No, I think we talk a lot about collaboration, and that's a difficult game. I think we have to. Sometimes the problem is who leads this collaboration and who sets the rules.
Yeah.
So that's the tricky game, and we need someone to do it, and then collaboration may happen.
Let me just add one thing there. That's exactly what we try to do on just to speak a little bit about Beta. That's exactly what we are trying to do. We try to make collaboration and innovation. That's our new way of telling to the world that we don't just do acceleration. We also make the match between startups and corporations, and we make sure that they collaborate with each other. Especially like you were saying right now, we need somebody to do it, and there are some organizations that are doing it. And just to complement your.
Oh, sure, because at the end we need to set a goal, set some rules, and then who does what and why. So, well, it's not easy because who is setting the rules, who is leading. That's what the political interests sometimes are not good because go against the what needs to be solved, and sometimes hiding the willingness to hide some of the reality, uh, and also the performance and the data, data of the evolution on this problem. All these are tricky problems.
Thank you. So to finish, the last question. Let's all smile a little bit because now we went to that deep waters and now we need to get out of there. So I want to ask each one of you what's going on with your company and with your life right now. Really fast, how do you see the present, that we are dealing with the present, and how do you see the future? Do you see a bright future, a dark future? Tell me your opinion about this. Tell me what's going on your company, and thank you. Fine, want to go first?
Yes, for sure. I mean, well, I really hope that we can take part in building something that makes sense. And as I said, we're focusing on the aftermath of what comes afterwards to solve problems that will be after this thing, because I also think we have a responsibility to do that. We have been very fortunate to just receive some funding from the Horizon 2020 program in the EU.
Oh, congratulations.
So that has extended our runway for the next 18 months, and we are actually hiring. And we hope that we can maybe take advantage of this, that we now is in a very solid position to do what we are supposed to do. So I really see a great opportunity here, and I hope we can take that on in a responsible way and build some healthcare technology that actually works and brings value to the hospital. So for me, it's good that we have a lot of focus on this, and I will try and do the best we can to take advantage of that.
Thank you. Eduardo, wanna go next?
Yeah, thank you. So we're seeing a lot of demand, both with the hospitals and pharma industry that compose our client list. And we are very happy to really use the tools that we have already developed to scale this medical training to every professional, because this is a major use case for us. We have a clinical simulator that allows physicians to train and to receive a detailed feedback on what they did right or wrong. So in this, when you're managing a healthcare group that has like 6K physicians, and you have coronavirus in a weekend, you need to train everyone really fast, and we can provide that. We developed a lot of content for that, to help hospitals with that. And we're also thinking ahead, because the demand that we have right now is also thinking in the recovery phase, and how we can provide clinical protocols for physicians to be very effective and efficient while treating the chronic diseases are going to surge after the COVID pandemic. So it has been very interesting for us, both in demands on the client side and amazing on the engagement of users. It has been very interesting for us.
Thank you so much. Cristian, tell us what's going on.
Well, we have been solving an unsolved problem in the world since many years, which is guiding people to the right level of care when first symptoms arise. Of course, we can help a lot of people now with this COVID-19 crisis because all healthcare facilities are saturated, call centers. Everybody thinks that having any symptom is having COVID-19. So we can really add a lot of value trying to help these people find the right way in the system. And we offer our technology to all these health institutions. We fine tune to the local protocols, so we can link a solution to the real next best step in your country, in your city. And for us, of course, it's a great opportunity because something that we have been pushing for many years, now it's more obvious. And we can help not only today with this crisis, but afterwards, because we help with any disease. And even in the next wave, we will have the COVID-19 mixed with all the regular disease. So
Yep.
we will need to guide these people to the right place. And in that wave will be more tricky because it will not be an easy thing just asking the 4 main symptoms of the COVID-19. So for us, we see a great opportunity to really think things happening in months, which may take years before, and also helping a lot of people. And that's our main mission, to improve access to healthcare worldwide.
Thank you. And now, because we are on YouTube, and I must say this, don't forget to like and subscribe if you like the video. It's really important to help the community, to help the podcast grow. If you like this conversation as much as I like, you're definitely going to like and subscribe, because there's a really nice conversation with really interesting people. Thank you so much, Stine, Cristian, and Eduardo. It's been great. Thank you for spending the night with me, at least this couple hours. Now we all go to have a good nice dinner, have a good sleep, and let's work tomorrow into the collaboration and innovation, and make sure that we all do our part in having and creating a better world for tomorrow, thinking on the present. Thank you so much, everyone. And with this, I'll finish, and we'll see you next week. Thank you.